Bluetongue in small ruminants especially. Etiology, it's a very simple. The virus is transmitted by arthropods. That's why it's the arthropod-borne disease, and this is caused by the orbivirus, and family is Reoviridae family. There are 24 subtypes of the orbivirus. This virus is truly endothelial tropic, means it affects the blood vessels only. Transmission occurs through the culicoids. Vertical transmission from parents to offspring is observed generally in the pregnant animals. Direct seeding by the mechanical transmission through the infected needles, it can be possible. Small ruminants majorly affected by the bluetongue, sheep and goat, deers. Occasionally, cattle and buffaloes are affected, and wild ruminants, they are also affected by the bluetongue infections. Predisposing factor, this plays very important role. Nowadays we are seeing the heavy rainfall everywhere in the every part of the India, and it is a most ideal environment for the vectors, that is culicoids. So whenever there is a waterlogging conditions due to the persistent rainfall, there is a development of small ponds, non-free flowing type of water, it is an ideal place for the breeding of the insect, that is culicoids. Multiple organic matter around the ponds enhance the breeding of the insect culicoids. A lack of sunlight or dampiness, whenever there is a cloudiness in the environment, definitely the sunlight is not there, and because of that, the animal is not able to synthesize vitamin D, which is responsible or which is required for the better immunity. So that's why whenever there is a sunlight is not available, animals are suffering from the immunosuppression, and that is because of the deficiency of the vitamin D. Then deficiency of vitamins and minerals, along with the whatever the pastures are there, the pastures are also having the deficiency of the essential nutrients, and that leads to the immunosuppression. So these are the predisposing factor. Nowadays we are observing these type of conditions present around we people, and that's why many cases of bluetongue are observed in the various parts of India. Like this dumpiness, no sunlight, like this the small ponds are there and the animals are grazing around it, and whenever they are reaches to this such type of waterlogging conditions, the insects, they are present over here. They can easily bite to the animals, and the sheep and goat get infected by the bluetongue. These also, this is a bluetongue carrying arthropod culicoids. Mostly the transmission of bluetongue is occurred by the bites of the culicoids, insect culicoids. Then direct transmission by the biting of the some flies like tabanus flies, that is a mechanical transmission. Also the mechanical transmission can be observed because of the infected needles. One thing also observed, the semen is also responsible for the transmission of the bluetongue in case of the sheep and goat. Vertical transmission from parents to offspring during the pregnancy. These are the routes of transmission of the bluetongue viruses. The pathogenesis includes, first, there must be the bite of the insect to the animal. After bite of the insects, the virus enter into the body of the sheep and goat. Then virus reaches to the local lymph node. Wherever the bite is there, maybe the head region or the leg region, the virus reaches to the local lymph nodes through macrophages. Then from local lymph nodes, it will reaches to the blood. After viremia, the virus gets settled into the various endothelial cells, and it's again start the multiplying in the vascular endothelial cells. After that, there is a proliferation of vascular endothelial cells, and that lead to the mostly it is observed in the end type of blood vessels. And once there is a proliferation of vascular endothelial cells, there is a occlusion of the small capillaries, and that lead to the multiple abnormalities in the blood vessels or the capillaries. Whenever these blood vessels of the tongue, lungs, coronates, and lamina are affected, the animals are showing the symptoms. Those are related to the tongue, lungs, and coronate and lamina. Variable degree of the edema, congestion, and cyanosis can be observed depending upon the how many blood vessels are affected, how much area are affected by the these viruses, that lead to the different alterations in the clinical signs as well as the pathogenesis of the these bluetongue viruses. After that, whenever there is a development of edema, congestion of the head region, oral cavity, as well as the lamina, then there are chances of the secondary bacterial infection, and ultimately the death of the animal is observed because of the hypoxia, as because large number of capillaries are present in the lungs, and that's why the capillaries of the lungs are mostly affected by this virus, and there is occlusion of the capillaries, and that lead to the improper oxygenation of the blood, and that lead to the hypoxia. And the another cause of death is acute inflammation, hypoxia and acute inflammation. So ultimately death is occur because of the hypoxia and acute inflammation. Clinical signs: swelling of mouth cavity, face and tongue. There is a high fever. Some animals show lameness, respiratory distress is there. Sometimes salivation is there because there is a swelling of the tongue and animal is not able to engulf or deglute the saliva. Then swelling of gums, oral mucosa. In severe cases, whenever there is a affection of the large number of capillaries, then that lead to the cyanosis of the oral cavity, then the tongue. Blue discoloration of the oral mucosa is observed, blue discoloration of the tongue is observed, as well as the blue discoloration of the coronate also observed. Then abortion can be observed in the pregnant animal. So these are the clinical signs. Depending upon the intensity of the infection, there is a alterations in the swelling of mouth cavity, face, tongue. High fever is also there. Lameness is also present in the Bluetongue. Respiratory distress is there. Salivation is there. Swelling of gum, oral and oral mucosa. In severe cases, cyanosis and blue discoloration of the oral mucosa, tongue and coronate can be observed, and abortions observed in the pregnant animals. So these are the clinical signs. Here we can see the pictorial representation of the whatever we have discussed earlier: oral papillae and hemorrhages and cyanosis. So here you can see at the tip of oral papillae we can see the small pinpoint hemorrhages, as well as you can see carefully there is a cyanosis of the oral mucosa, and little bit you can see the edema and the swelling of the tongue also. Here also you can see the swelling of tongue, oral papillae, hemorrhage and cyanosis. Here oral papillae are showing the hemorrhage at the tip of papillae and cyanosis. Lameness will be like this sometime. Animal is not able to walk properly. Then congestion and cyanosis of the oral mucosa and hard palate. So this is also the postmortem lesion, but here has been shown in the clinical signs. So once we open the oral cavity, we can see either cyanosis, congestion, erosions, and the hemorrhage on the these papillae. We have to observe each and every papilla carefully, so we can get this small pinpoint hemorrhage at the tip of the papillae. Congestion, cyanosis of the oral mucosa and hard palate. Here hard palate is affected. The same thing also here: congestion and cyanosis of the oral mucosa, congestion and hemorrhage on the oral papillae. Here you can see these are the oral papillae, and we can see some of the normal papillae are over here, and these papillae are showing the hemorrhages on the tip of the papilla. The triangular shaped papillae are there, and we can get the hemorrhages on the tip of this papilla. Congestion and hemorrhage and cyanosis of the oral mucosa also. Here also same thing, palate, hard palate is affected. Here you can see congestion and cyanosis of oral mucosa. You can see severe congestion over here and cyanosis also there. Here you can see throughout the oral mucosa showing the cyanosis, cyanotic changes, completely cyanotic changes. Again same thing, cyanosis, congestion and cyanosis of oral mucosa. Here you can see somewhere you can get this pinpoint hemorrhage also on the papillae. Here also papillae, hemorrhage on the papillae. Here also hemorrhage on the papillae. Small tips are there, and we have to observe that tips for the confirming the Bluetongue. After clinical signs, we can see the postmortem lesions. That is most important factor, because clinical signs may be confusing for we people, and whenever deaths are there, we should go for the postmortem examination, and it is the very important tool for the diagnosis of the Bluetongue at the field level, because some of the pathognomonic lesions they are present, and that is present only in case of the Bluetongue. So that's why we should go for the postmortem. It is not so hard job. It is a very simple job, easy job. But we have to observe what to observe, and what exactly organs to be explore and observe for the Bluetongue. So the first thing is that as per book, we must get the cyanosis of tongue. but we are not getting cyanosis of tongue in every case. There are a variety of changes can be observed depending upon the how many numbers of the capillaries are affected and how many endothelial cells get occluded. Based on that, we can get the variety of cyanosis in the oral mucosa. So postmortem lesions mostly comprises of the cyanosis, congestion, and edema of mouth cavity, swelling of head and face. Oral mucosa will show variable degree of edema, congestion, and cyanosis. Lung edema is a consistent finding. Cyanosis of the lung is also consistent finding. Though we are getting or not getting cyanotic tongue, but we must get the lung edema and cyanosis of the lung. Hemorrhages and aorta, it is also the pathognomonic lesion. So this is a hemorrhages on aorta. It is a pathognomonic lesion for the Bluetongue virus. Though we are not getting any lesions in the oral cavity, not hemorrhage on the papillae, but once we get the hemorrhage on the aorta, this could be considered as a confirmatory for the Bluetongue virus infection. For that purpose, we must do the postmortem. At least we should go towards the heart and observe the different aortic arches. So that is most crucial thing during the postmortem of the Bluetongue affected animals. Variable degree of the congestion, edema, and hemorrhage of the intestines based on the how many days viruses remain in the body. Then intestines, rumen, and reticulum. Excessive amount of pericardial fluid can be observed. These are the major postmortem lesions that can be observed in the Bluetongue infection. Now here we can see one by one different postmortem lesions. Here cyanosis of the tongue. If you see, the tip of tongue is having the bluish discoloration. Congestion and cyanosis of oral mucosa. If you see, this line is affected, having the showing the cyanotic changes. Here we can see the tongue is also swollen and not that much of cyanosis is there, but the gingiva is showing the cyanotic changes. Here you can see the cyanosis of tongue also, cyanosis of gingiva, and little bit the oral mucosa is showing the cyanosis. And if you see carefully, the tip of the oral papillae, they are showing the small pinpoint hemorrhage. At the tip of papillae, we are getting the small pinpoint hemorrhages. So these are the confirmatory, we can say, lesions for the Bluetongue. Then cyanosis of lung. There is no consolidation, nothing is there, but the total lung is affected and the whole lung is showing the cyanotic changes. Here also we can get the cyanotic changes throughout the lung tissues. Then pericardium is having the excess of pericardial fluid. If you see carefully, you can see the heart is present somewhere over here, but the pericardial sac is having the excess of clear fluid. No flakes, nothing is there in case of Bluetongue. Only the presence of the clear serous or watery fluid in the pericardial sac. Then variety of hemorrhages can be observed in the aorta. Somewhere we are getting the small pinpoint hemorrhages on the aorta. Here you can see very small dot-like hemorrhages on the aorta, or at the base of aorta we can see. Here we can see little bit more hemorrhages. So 1, 2, 3, 4, 5, 6 pinpoint hemorrhages in some of the cases. In some cases, we are getting the flashy type or the splash or the pen type of the hemorrhages on the aorta, base of aorta. In some of the severe cases, we can get the throughout aorta. A big portion of the aorta is affected by the hemorrhage. So these are the pathognomonic lesion of the hemorrhage on aorta. So could be very small, a small pinpoint hemorrhage like this, small pinpoint hemorrhage like this. In some cases, little bit more hemorrhages, and in some of the cases, ecchymotic type of or the pent type of hemorrhages. Then in severe cases, we can get the throughout the aorta, they will show the hemorrhages. So these are the some differentiating point we can conclude for the aorta in case of the Bluetongue. Here also we can see the extensive hemorrhage or at the base of aorta. Then ruminal wall will show the congestion and hemorrhages on the ruminal wall. Then cyanosis of hoop or laminitis. If you see, this is a hoop structure has been cut over here, and you can see the clear-cut cyanotic changes in the hoop region. So this is a laminitis plus laminitis and hoop is affected, and cyanotic changes. Edema is there. You can see the watery fluid accumulated over here. So these type of changes we have to observe in case of the Bluetongue in case during the postmortem examination. The kidneys are also affected because kidneys are also having the end capillaries. So after postmortem examination, we can see the diagnosis of the Bluetongue. So diagnosis will be based on postmortem examination, clinical signs, and intercorrelation with the environmental condition like this. Today or since last 1 month, we are facing the same problem. The complete cloudy nature is there, or cloudy conditions are there. Large number of colicoids are present in the environment, and we have to correlate with the clinical signs. What samples we should collect for the identification of the virus? So blood from the affected animals, serums for the serological examination. We can collect the lymph nodes. We can collect the heart blood. We can collect the tongue piece. We can collect the oral mucosal washings. In affected animals, we can collect the semen also. So these material can be used for the viral isolation for the laboratories. Then in laboratory, we can go for the AGID, but at field conditions, we are not able to identify these type of things. So viral isolation is not possible at the field conditions. AGID, agar-gel immunodeficient test, is also not possible at the field conditions. Cell culture is also not possible at the field conditions, and PCR is also not possible at the field conditions. So what we have to do? We have to collect these samples: blood, serum, lymph nodes, heart, tongue, oral mucosal washing, cements, and sent to the laboratory for the further investigation. That may includes the AGID, cell cultures, and PCR. Treatment, because there is no specific treatment for the Bluetongue virus, because as this is a virus, we should go for the symptomatic treatment like NSAID, some antibiotics, immunomodulators, vitamins, and rest to the animals. So this treatment strategy we can follow for the treatment of the Bluetongue affected animals. Prevention, vaccination before monsoon, control of colicoids, biosecurity, and separation of the affected animals. So these things should be kept in mind for the prevention of Bluetongue. Vaccination, 2 ml subcut above 2.5 months and above. So depending upon the company which are going to provide vaccine, the dose may be vary. But the Raksha Blue is having the 2 ml dose subcutaneously above 2.5 months and kids and lambs. Control of colicoids. So here we have to use fly repellent, spray of insecticides using mosquito nets, using mosquito tapes. Adhesive tapes are there, and on that adhesive tapes, the mosquito get adhere and get died on that tapes. So fly repellents, many fly repellents are available commercially, but they are costly also. It is impossible to spray every day, every time, and twice a day. It's highly impossible for the animals, for the farmers who are grazing their animals from one place to another place. And the insecticide spray is also dangerous to the animals as well as for the environment also. Using mosquito nets, it's somehow it can be applicable in the zero grazing type of sheds, but it is not suitable for the free grazing type of animals. Adhesive tapes also, the adhesive tapes can be used for in the intensive farming, but not in the free grazing or the grazing type of animals. Easy and cheapest source. So they can use very simple techniques to repel the as a fly repellent. Neem ke patte, neem leaves, fumes and smoke. The method of using, we have to take the dry cow dung cake, then allow half burn. So we have to burn it, but we should keep as a half burn. Don't make it into ash. We have to make it half burn. Then put some branches of the green fresh neem leaves on over it and allow it to smoke. The smoke will be little bit having the bitter smell, and because of that bitter smell taste, the all flies whichever present around that vicinity will run away from that particular area. So we can put such type of material, neem ke patte, and make a smoke of that neem ke patte around the farms, 4 to 5 places around the shelters. So especially in the evening hours. So that will be most important factor to repel the all type of insects at the farm level. So this neem ke patte neem leaves and this dried cow dung. So a combination of both is a very good fly repellent for the everybody. Biosecurity is very difficult in the grazing type of animals. In organized farm, it is possible. Control of insect is the most important step in the biosecurity measures. So whatever the ponds which are present around any farm should be removed. So whatever the water logging conditions are there, we can put some sand or anything, and we can fill up that ponds, small pits, and make it free from water logging conditions. And then we are not able to, or we are not giving a good environment for the culiacids. So the basic thing is that we should control the insect by destroying their breeding places. Separation of animal. This is also difficult in case of the migratory type of animals, but it can be done in the organized farm. Common complications of the Bluetongue virus infection in sheep and goat. Generally, hemorrhagic septicemia is occurred because of, as we know, during pathogenesis, we have learned the lungs get affected, lung edema is there, and immunosuppression is there. And because of immunosuppression, some opportunistic bacteria can grow in the respiratory tract of the sheep and goat. So HS is one of the secondary bacterial complications can be observed in a Bluetongue. In some cases we are getting the PPR complications, in some cases FMT complications, somewhere foot rot is also there, and in some cases there is a non-steroidal anti-inflammatory drug toxicity is also observed during the Bluetongue infections. So these are the things we can observe as a secondary complications for the Bluetongue. Important things to be keep in mind for the Bluetongue: vaccination before rainy season, 2 ml subcut to the all animals above 2.5 months. Avoid vaccination to advanced pregnant animals. Deworming before vaccination. Most of the farmers, we have to convince these farmers that they should go for the deworming, and then after that they should go for the vaccination. But they are not doing like they are not following anything. Just they are vaccinating the animals, then they go for deworming, and then they go for some tonics. So that is not ideal. It is only the wastage of the money. So we should give some knowledge to these farmers, and they should vaccinate the animals in a proper way. So first deworming, followed by the vaccination, and some tonics, immunomodulators should be given. Then avoid areas of the grazing where the waterlogging conditions are there. Those farmers are grazing their animals, so they should avoid waterlogging, grazing of the animals around the waterlogging conditions. Then destroy the organic matter properly in compost pit. So in case of the organized sheep and goat farms, they should destroy whatever the organic material is there. They should be disposed in a compost pit very properly. Regular spray. Then we have to use the neem leaves to repel the flies. Regular feeding of the immunomodulators to the animals during the, especially in the rainy season, whenever there is a vitamin D deficiency is observed because of the lack of sunlight. Avoid overdosing of NSAID. So painkillers can kill the animals too. So generally what happen, the farmers reaches to the medical shop and they purchase the NSAIDs, and they are freely using NSAIDs, and because of the NSAIDs there is a rupture of the abomasum and extensive damage to the abomasum are observed, and animal is died because of the excessive doses of the NSAIDs. So avoid self medications, avoid self belief. So this is generally we should follow, or we should teach to the farmers that they should avoid the self medication, because due to the self medication they are giving the excessive doses of the NSAIDs, and ultimately that will help to kill the sheep and goat. Take advice and help of the veterinarian. So we should educate the farmers for these things. They should come to we people, and they whatever the things had to carried out during the outbreaks, we should teach them accordingly. Carry out the postmortem examination of the dead animals. Generally we are not doing at the field conditions, but it is most important factor to rule out the different possibilities of the different disease conditions. So for that purpose, we should carry out the postmortem examination of the dead animals which are suspected for the Bluetongue. Then dispose the carcass properly. So these things we should keep in mind to control the Bluetongue infection in the sheep and goat.